no pressure. Placing lotion, light strokes, moisturizing the skin, at the same time checking soft tissue state, bone mobility, range of motion within the joints, and connective tissue, superficial fascia. Some adhesion in the midfoot, and around the fifth metatarsal, checking hypomobile fifth metatarsophalangeal joint, fourth, the third and second, and restricted mobility of the first metatarsophalangeal joint here, and interphalangeal in big toe, giving some reflourage to the toes. Pressing down, middle toe, effloration, and now applying a bit more pressure inner side of the leg. Circular motion around the heads of the metatarsal, going up. One hand is treating, one hand assessing the tissue. And repeating it. Down. Checking the pinky toe and the metatarsal, going up and starting from the heel. Applying some lotion. Going with circular movements. Pressing. Have some restrictions right here. Applying more pressure. And now going parallel. Still we need some more lotion. Press, push it down. side to side. Using just one hand, one is stabilizing, one is applying compression. Notice the color change from pale to pink. Pressing on the inner side. Same color change from white pale to pink, and right in the middle of the foot, pressing down, changing the color. Pushing it up, adding more. Going clockwise, counterclockwise. Pressing, holding steady, applying the broad side of the acupuncture stick. This area of Achilles attachment. Press and going to the midfoot, adding lotion. Using my gua sha metal scraper. Excellent change in vascularization, skin tone from pale quickly getting pink. Using my tool, getting the tissue mobile. Moving side of the pinky toe. Flashing and releasing. Changing the grip and mobilizing. Excellent. Again, the foot is pink, more pinkish than before the treatment. Making our way to the heads of the metatarsal and the toe. Checking the mobility of all toes. restriction in the big toe, restricted mobility in second toe, third, fourth and fifth. Using my acupressure tool to press and separate. Next one. And next space. And the space between pinky and fourth one. Pressing the base of the phalanx. Next, going to the fourth one, pressing with the pinkies. Push and smoothing it down. Two, three, changing direction. 1, 2, 3. Going all along the foot. 1, 2, 3. Some pressure between the head of the metatarsal. Next space. And the middle one. Now the space between index and big toe, spacing it out. Good. Pressing and releasing. And now flexing the big toe around the massage stick. Pushing. Releasing, doing traction on the big toe, flex, and flex. The middle toe, we do some flexion, nice extension. Next one, it's more difficult to flex. Extending. And the fifth one, flexing and extend. Wrapping the toes around acupressure stick, pushing them down. Excellent. Using my scraper as the hook to release the big toe tissue. Moving to the middle, using my shiny gua-sha tool, changing my grip. And sliding down. Nicely effleuraging a bit more. And applying pressure from the heel right in the middle of the foot. 1, 3 strokes, 2 and 3. Moving a bit sideways, medial. 1, 2, 3. Very inner part. 1, 2, and 3. Now slowly, gradually moving to the left, to the side of the pinky toe. 1, 2, and 3. And we can see how pink it is. Compressing. Release. So again, compressing, releasing, compress, release. Push here. Stronger pressure. Using my fingers while holding calcaneal bone where it belongs to, all in place. Press, press from the side, release, press from the side. One by one, cross motion, pressure. Seconds, release, 15 seconds, release, from the heel to the midfoot, holding the heel bone, pressing, release, pressing, push, release, adding some motion, sliding from inner middle part to outer parts. 1, 2, press, the outer part, the inner part, brushing with different parts of my hands. Now the hands are chasing. Moving. Soothing tissue with more of a brush, very light and gentle strokes. Starting foot massage of another athlete, and it's usually checking the state of the soft tissue, doing effleurage using the lotion, starting from the heel, moving to the front foot, and then towards the toes. Small fixation in the calcaneal area, here right at the heel, more on the inner side, checking the superficial fascia, tissues in the midfoot, adding more lotion, continue with effleurage. And pressing down, very light, okay, accessing heads of the metatarsal. Again, we can see more fixation on the inner side. Tissues are not so mobile around the head of the first metatarsal, right here. Also, there is a lack of tissue mobility here. And checking the fifth toe. Immediately can notice joint was not moving well. Flexed position, checking mobility of every toe, including the big toe. Excellent. Good deviation. Limited flexion in this joint, metatarsophalangeal, and continue with our effleurage. See that lotion is getting absorbed into the skin. counter-directional movements, inner and outer side. Synchronize from heel to toes. 1, 2, 3. Applying more pressure around the heel. Circular motion. Clockwise and counterclockwise. A bit more pressure. From the outer side, using just the tips of my fingers. Moving counterclockwise. Using my finger flexed position, holding V-shaped grip. Pressing. Pressing and release. Again, pressing and releasing. And moving towards the inner part of the foot. Applying pressure. Release. Press. Release. Gradual movement to the midfoot on the inner side, and working precisely with the fixation, pressing and moving, pressing, moving, stepping a bit down, pressing and moving, applying pressure with my thumb. Feeling that adhesion is melting under the beak. Feeling it with my thumb. Checking for the mobility. Tissues are softer. Pressing here. Again, using my index fingers. Cross tissue pressure. And downwards. Right to the midfoot. Applying pointy pressure with volcanic stone right in the area inner side of the heel. Pressing for about 45 seconds. Controlling the tissue and release. Applying more lotion. Pushing. Moving from the heel to the midfoot. Working with the superficial fascia. Using the opposite side of the volcanic stone tool. Adding a bit more lotion. Noticing the color change of the tissue. Getting pinkish. Applying compression. Release. And again. Scraping the tissue. And effleuration. Just using 3 fingers. 4. Nice and soft mobile tissue here. Flush. Moving to the midfoot. Slowly checking. Here's the fixation. There is one above. Moving through. Just using my thumbs, chasing each other. 1, 2, 3, 4. Getting soft and mobile. And moving to the 5th toe, 5th metatarsal bone, which is right here. Checking for mobility. There is a soft tissue fixation here. Applying more pressure. And repeating. Feeling increase in mobility. Squeezing and going around. 1 pressing round motion with a thumb. Again, pressing with my thinner part. Moving around with the thumb. Once again. Effleuration. Again, using my volcanic stone tool, hooking the base of the 5th metatarsal and moving up to the small toe, along the tendon, all the way from the midfoot to the head of the metatarsal, pressing it down about 15 seconds and releasing, and again applying some lotion. Hooking, going down once again, repeating, pressing, releasing, push, releasing, pressing, releasing. And using this part, wide, broad pressure, and fluorescing with my hand. Now we are going to work precisely at the head of the fifth metatarsal. Lotion, and grabbing the pinky toe, pressing on the head of the metatarsal and extending it, extending, pressing on the base of the phalanx, sideways, flexing and extending, checking for mobility, a little traction, pressing here and applying traction. You can see the increase in mobility. Increasing mobility in pinky toe. Going for the next one, the fourth toe, pressing it, flexing, extending the base of the toe and the head of the metatarsal. Flexing and extending, pressing to the base of the metatarsal, the middle one, and gentle traction and release. Checking for the space between the toes, spacing them a bit, and working on the second toe. Definitely there is a limited flexion, so we are applying first gentle traction, hyperextension within the physiological range of motion. Right here, little traction and flexion. Again, traction with hyperextension and flexion. Moving the big toe medially, inwards, applying some flexion, pushing it down, extending, hyperextending within the physiological normal range of motion. Applying traction, hyperextension and flexion. Pressing down to the base of the thumb, flexing around, release. Pressing. You can notice the color change. And release. Using my acupressure tool, acupressure stick, to space the toes, gentle pressure, pressing on buffoon points. 1, 2, 3, 4, pressing right here between the first and second metatarsal, smoothing it down. And again using effleurage. Bit of fixation at the very medial inner side of the fifth metatarsal. At the sesamoid bone, gentle pressure, lateral deviation, traction, and manual positioning of the sesamoid and the base of the first toe, big toe. Okay, gentle traction and deviation, flexion, extension. Going around the midfoot. Still we can feel some restrictions in the midfoot, so we are going to work on it to make it fully mobile. Here a little bit of fixation is left. Pressing, releasing, applying finger pressure, and returning, compressing counter-motional, counter-directional, mobilization, slowly compressing the tissues and releasing, again compressing, releasing, working around that mole. And moving right to the midfoot. Progressing to the outer part. Compress and release. Compress and release. And applying pointed acupressure point, thumb pressure. Once again, moving to the outer part and distal. Applying index finger compression. Using my thumbs. Going around this area where we still feel tissues not perfectly mobile. Pressing and using circular motion, moving just here without changing the position, applying again, press, alternating our thumbs. Using acupressure points, noticing the color change from white and bluish to pink. And effloration, light, broad strokes. One, two, and three from the heel down, from the heel down, head of the metatarsal.